sir. So just a small introduction about him. We have him from he has been an assistant professor, Department of Shalakya Tantra from MES Ayurved Mahavidyalaya. So he has been working as assistant professor from past 5 years, and to his honor, he has had 3 years of external training from pediatric ophthalmologist and also from a pioneer posterior segment surgeon in one of the reputed institutions of Navi Mumbai, and he has also been having a lot of experience in the field. He has published more than 200 articles in social media, as well as 3 research publications in international journals and 6 research papers in national and international conferences also. To his achievement, he has had first prize for his research paper by the title Ayurveda Treatment in Diabetic Retinopathy, held at Kochi, Kerala in 2018. So this is a great time to have you, sir. So hearty welcome on behalf of the department and the institution, sir. Over to you, sir.
Hello, good afternoon, everybody. Hello.
Yes, sir, you are audible. Good afternoon, sir.
Sir, my PowerPoint is visible?
You are yet to share your screen, sir.
Yes. 1 minute, sir. Now, sir?
Yes. It just came and went. Yes, visible, sir. Visible.
So wait for a moment.
No issues, sir.
So PowerPoint is visible? Hello?
Screen. Initially there was a slide, but now it is a gray background.
Yes,
Blank screen.
some blank screen. No, yes, wait for a moment. Sir.
Yeah.
Yes. Now it is visible?
Yes, absolutely.
Yes. Thank you very much, sir, for giving me such a opportunity to communicate with the PG scholars student. Yes. Now I will start with my lecture. So today's topic for the discussion is very useful for the PG student, first year, second year, third year also. So after discussion with Dr. Naveen sir, so I decided to select such a topic which will be helpful for them in their afterward practice in the ophthalmology, Ayurvedic ophthalmology. So I have selected the topic's name is like the approach to a clinical practice in Shalakya Tantra, that is the Ayurved ophthalmology. Yes, we can term it as a Ayurved ophthalmology. Yes, we start with the grace of the Dhanvantari. We start our lecture today. So, is this approach? Is this a approach? We think about the Ayurveda ophthalmology. That is, the eyes are the separate entity from the body, or it is a one of the part of the eye. Sometimes we think before the study or the before the start the MS Shalakya Tantra course, that is eyes are the different entity from the body. So we have to change the such a approach to the to this one, that is the eyes are the one of the most important part of the body, and this is not a which is separate entity from the body, it is a one of the part of the body. So which medications are helpful for the bodies are the similarly helpful for the eyes also. So if we give a medicine, oral medication for jwara, raktapitta and other disease, same drugs are very useful in the treatment of the eyes. So from today onward, we should think, we should have an approach like this only. So eyes are the uh, part of the body, it's not a different entity. So some problem in the PowerPoint, I think. Mm, the purpose of this topic is to motivate you for the treatment of the eye disease through the Ayurved modalities. So I have selected this topic to motivate you and to give some hints to steps to enrich your knowledge about the Ayurved ophthalmology. So we start with the why. So everything or whichever we are things which are going to start, we should start with the why. So why, the question why is a very important entity from the other questions like what, how. If we start with the why, then we are getting the chances of the success very well. So in this we should start with the why. So our purpose is, what is our purpose behind the studying the Ayurveda ophthalmology and practicing the Ayurveda ophthalmology? Then how is our approach? Our approach should be like this. Our approach should be like that. And which what things are we are going to do? We are going to do. This is the third most important part. So after starting with the why, so why we are starting this entity like the Ayurveda ophthalmology? It is useful for the society, or it is for the upliftment of the Ayurved, or it is one of the um, uh, under knowledgeable things in the Ayurved or any other thing. So we should start with the why. Everybody should understand this concept. That is, one book is also there. Start with the why. So if you interested, you can read that book. So do you feel any obstacles in the getting knowledge about the Ayurvedic ophthalmology? Means any doubts, any lack of confidence, and other things. So, if we start with the why and we have the map and proper goal setting and the things which are we are going to do in our future life, if we know these all things, so there should be no any obstacles. Or if there are obstacles, then if you know very well how to deal with it, you can overcome that obstacle. So which things are stopping you? Have you thought about that? Have you talked to yourself about these things? Are you feeling a lack of confidence? Means are you feeling no, I am not able to, no, I am not will able to practice Ayurveda ophthalmology. I will not able to treat the patient with the Ayurvedic treatment. So some students have the belief that we don't believe in Ayurveda. We only believe in the allopathy. So some students have the lack of the knowledge. They don't read the books. They don't see the cases, observe the cases. They don't master in their clinical techniques. So basic clinical skills are also important, like the tonometry, 90-day examination, 20-day examination, pan ophthalmoscope examination are the basic things which should be every student able to perform. Some students have the lack of goal setting, means They don't know what they are going to do, or what they will do in the future life. So they just pass their day of their post graduation studies. They don't set the goal. So after after few sites, we are going to discuss about the goal settings. So if we start with the benefits, if I tell you the benefits of the Ayurveda ophthalmology, we definitely get we will you will definitely get motivated for the practice in the Ayurveda ophthalmology. So after starting with the practice of the ophthalmology, the first few years are very struggling. If you are patient, then you can master your technique, master your practice, and you will be the unique. Yes, if you start as a clinic at your town, there will no anyone which will be practicing like yourself. So you will be unique. So and you will be exclusive. If the patient wants the treatment about the eyes, about the disease of the eyes, so patient will exclusively come to you. So and because of that, you will be far ahead of the global competition. You know the current scenario of the ophthalmology competition. So there is a tough competition in the current era. So you will be far ahead of this global competition because of your exclusiveness and uniqueness. So and after that, you have the lots of chances of the self improvement. You can improve yourself by day by getting the new experience. So then you will get the challenging cases to treat. Yes, of course, this is the most important part. So patient will come to you with the bunch of the files, bunch of the reports. So I have visited so many modern ophthalmologists, I am not getting the results. So I have come to you, you are my last chance or last faith. So you have to deal the such a challenging cases to treat. If you treat the such a cases, you will be a we will be you will be getting success in your life. People will pray for you. Yes, this is the most important thing. Then after the along with this, you will get the chance to contribute in the research activities. This is the most neglected part in the clinical clinical practice in the Ayurveda. So if we maintain the proper data, if we publish the paper, if we contribute to a research activities, it will be useful in the next generation. So start from the day one, you should maintain your data. If you treat the case, you should you should write it on the paper. Follow up this also follow up the cases very well, and you should write down the each and everything about the that case and maintain properly. And afterward that, you should write a case series of that. This will helpful for the next generation and also for yourself also. So these are the most important benefits of the practicing Ayurvedic ophthalmology in the society. So are you ready? Yes, here are the some steps to get success. We are going to into this step or topic now. So here are the first here are the few steps to get the success. So before going to for the war, means before going to practice in society, what should you do? That you should be confident that you are having a weapons like this. Do you know the weapons? Yes, the weapons should be for the uniqueness of your practice. Means you have the basic concept of the Ayurveda, unique concept. These are not concept not at all explained in Ayurveda and other science of the treatment. So here are the basic concept like the Agni, Am, Doshadhatu Mala, and Panchamahuta, Poshtagati, Shakhagati. These are the most important and unique concept of the Ayurveda. And also the Nidan Panchak explained in the Ayurveda is its unique feature. Means you have the thinking steps behind that. That is the Hetu Vichar, unique concept. Means the patient got the disease by which Hetu, which things are the positive factors for the this disease, which we are able to think with the help of the Hetu Vichar. Then Samprapti is also unique concept in the Ayurveda. So we can make a flowchart of that samprapti and think over it with the help of the dosha, and anshamsha kalpana also. So you can use all the modern equipment. This is a most important benefit of the practicing. So every from the chair unit, slit lamp, autorefractometer, gonioscope, and all these modern equipment we can use for our proper diagnosis. There should be proper and pinpoint diagnosis. You should able to diagnose the case according to the modern science also. So we can use these modern equipments very well, and you should be familiar with the using these equipments. This is the most important benefit, means weapon we have. So you should able to use these instruments very well in your PG student and your fellowship and other experience courses. You should master yourself in the modern equipments. And one of the most important weapon we are having are the n number of medicine, means which means we have the very n number of formulations like the churna, kashaya, ghruta, and their different combination. You must be knowing that the Shadvirech and Shatashriti are there. There are n number of formulation explained in that. So this is the our weapon of the Ayurved practitioner, that we have the medicine and we have a great choice of the medicine. So we can select the medicine according to Prakruti, according to Dosha Avastha, according to the Vyadhi Avastha, according to the Bala of the patient. So uh, medicine is not a problem for us. So we use the medicines according to the proper state of the disease. And the other weapon, unique weapon, is that the kriya kalpa. So everyone must be knowing that the kriya kalpas are the unique mode of administration in the ophthalmology. So tarpan, puttapak, ashrutana, parishek, anjana are the one of the most neglected kriya kalpa is bidalaka. So I am using a bidalaka a lot, bidalaka and ashwatana. So bidalaka is having the most important, most encouraging result in the treating all the ophthalmic entities. So we have the, and the bidalaka is easy to use by the doctor also and the patient also. So this neglected part of the treatment modalities are the kriya kalpa. So other kriya kalpas like the which are used in the ENT disease like the nasya, gandusha is also important part of the Ayurved treatment for the eyes. So gandush plays a very important role. So another, everyone knows the weapon is the panchakarma. So some disease panchakarma can be advised. And our treatment, the uniqueness of our treatment is a Shuddha Chikitsa, means the Ayurvedic treatment is a Shuddha Chikitsa, means it does not produces any side effect and other harmful effect in the body if we use the medicine properly and judiciously. And the one of the important features required for the ophthalmic disease is a apunarbhava chikitsa, which is the most important weapon in the hand of the Ayurved practitioner. So in the cases of like diabetic retinopathy, anterior uveitis, and episcleritis, nodular episcleritis, and all these things, the recurrence is there. So disease recur in the after 2 to 3 months. So after treating this disease with the Ayurvedic treatment, we should able to give the apunarbhava chikitsa, which is very much important for the treatment in the Ayurveda ophthalmology. Are you getting the point? Do you have these weapons? Yes.
Yes.
Yeah. So these are the steps for the going for the Ayurveda ophthalmology. So first and most important step is get the thorough knowledge about the subject. Yes, you should read all these samhitas and you should compile all these materials from the Sushrut Sanhita, Ashtangruda, Yog Ratnakar, Bhaishajya Ratnavali. So you should compile all these things together and get the proper knowledge, which Acharya has told. Um, disease about the Pakshma Rog and other uniqueness, Pilla Rog, which Acharya has told. So you should able to compile all this knowledge, and you should put in the tabular or chart form, that you should not forget it. So this is Shalakya is a very volatile subject. So the one of the most important method of the studying is to make a chart, to make a table of this disease, and these diseases are to be revised every day, so you will able to able to understand all these disease in the very short time of span. Then set goals. The goal setting is a very important, that after if I taken the exam admission for the MA Shalakya Tantra in the college, then how I should spend my 3 years, how should be my first year of my uh, course, how should be my second year and third year. So all these goals are to be written on the paper. Have you written all these goals on your paper? most of these um, Most of the students forget to postulate or write the goals of their lifetime goals on the paper. So you should able to write your goals on the paper, and you should revise by day. So in first year I will read all this Sanhita and get the knowledge from the all the modern ophthalmic books. On second year I will examine, observe the patient, I will rectify myself, and I will master my technique. And in third year I will directly observe the patient, examine the patient independently, like that. After completion of the course, how which fellowship I will join, how I will increase my knowledge by visiting other institute. So in the last 4 years I visited some renowned institute in the Ayurveda ophthalmology, like Ituli Ayurved in the Mayil, Kannur, and of course at the Sridhari Kothadukkulam, and the Matha Institute Trivandrum, and Dr. L. Mahadevan's clinic at the Kanyakumari. So I visited all these institute to increase my knowledge, and to see which things are going there, which different things are going there. So you should able to you should go or the other institute, or other recognized institute, to enrich your knowledge. So last year I also visited that the Pondicherry for the eye exercise center at there. So I visited there to get the knowledge about the eye exercise, how the eye exercise affect the our refractive error, how they are very important for the treating the refractive errors. So you can also visit at the Pondicherry for the eye exercise center. Then most important things which we neglect, or we don't pay attention to that, that observe and examine each and every case. So if the very basic patient like the viral conjunctivitis come, you should observe the patient and examine independently. The presentation of the conjunctivitis, viral conjunctivitis, is different in a different patient. So some patient will have the mild symptoms, some patients will have the preauricular lymphadenopathy, some will have the membrane formation. So these are the different stages you should able to examine. So after this you should able to examine each and every case, and you should pay to every symptoms and sign of the patient. And earlier, as I have told, you should learn and master each ophthalmic technique and procedure. These procedures and technique you can only learn in your PG course. Afterwards you will not able to learn all these techniques. So you should make mistake in the PG curriculum only. So try and each procedure, like the tonometry, applanation tonometry, indentation tonometry, and reading also the um, ophthalmic technique like the OCT, perimetry. You should able to read all these technique. Understood? Yes. We move to the another side. So this is the basic study method which by which I have learned. My teacher from my teacher from the KEIM Hospital, Mumbai. So he's practicing pediatric ophthalmology in Navi Mumbai. So he guided me like this. You should able to observe the cases. First step is you should observe the case. As many cases you can observe, you should observe. Then get knowledge about the that case from the books like the Kansky and other iWiki website. You should able to read all these material, and you should write down the all about that disease from the internet and books. You should discuss that case with the your teacher, that which are the different parameters to examine the case. Then another the next step is you should able to examine the case confidently and independently by yourself. After observing the case, you should examine the case by yourself independently. After that, you will come to know, yes, this examination I have not done. So you should read the same case again and again. So from the book. So after reading that book, you will come to know that, yes, I have missed these sign and symptoms. Yes, I have not examined eyelids. I have not examined the cornea. No, I have not examined the iris of the patient. So on the next stage, on the next patient, you will able to examine with the more knowledge. So on the next stage, you will able to examine the possible stages of the disease. So these are the flowchart, or this is a cycle. This is the reinforcement studies for the examine the for the understanding of the any subject. So observe the case, read from the book, then examine the case, then again read from the book, and again they examine the case. This will enrich your knowledge, and you will be master in that subject. Yes, this is the most important flowchart. Then the methodology for the studying of the Ayurveda ophthalmology is you should able to write down the symptoms of the patient in a detailed manner. Then according to modern also and according to the Ayurveda also, if there is a Vata Prakop Lakshan, Vata Kshaya Lakshan, then if there is a any srotas involved, you should able to write on your case paper. So symptom is the most important part for the treatment of the disease. Then detailed history about that. I will not go detail in the history taking. So after getting the writing down the history, you should examine in the patient. This examination part is the most important. I have told the modern science examination means slit lamp examination, perimetry, tonometry. All these things are can be examined in the OPD techniques, daily OPD techniques, and special scans, OCT, pachymetry, perimetry. All scans should we should able to perform, and we should able to read. Most important is the reading part. So after seeing the reports of the patient, or the examining the patient, you will definitely able to read the scanning report of the patient. So most important part is now is a Ayurvedic mode of diagnosing the examination of the patient. So Rugna Parikshan is a very important thing, and another one is Vyadhi Parikshan. So I will not go in detail in this slide. We'll go in the next slide. So if we follow this part, means the hetu, which hetu are responsible for the disease, which is the samprapti for the formation of the disease, which are the Vadi Ghatak. So Vadi Ghatak is the unique concept of the Ayurveda. So which are the doshas, which are the malas, which are the dhatus, is there ama, is there any agni, how is the condition of the agni? There is agni mandya, agni vaishamya is there. So you should able to examine that. So and another thing most important is a Vadi sthan. It is a Vadi is where is the Vadi? Vadi is at the Vartma Sthan. Vadi is at the Krishna Mandal. Vadi is at Shweta Mandal, and Vadi is a Drushti Mandal. So you should able to examine, or you should able to think over this Vadi Sthan also. then come to the proper diagnosis of the Ayurvedic treatment, Ayurvedic thinking behind it. So we come to the point that Ayurvedic diagnosis and modern diagnosis. So after put forthing the diagnosis, we come to the next important slide is that I have earlier told, that is Vyadhi Ghatak. How is the condition of the doshas? Is it a Vata has increased or decreased? How is the condition of the Pitta? How is the condition of the Kapha? So these doshas are the not only present in body but also present in the eyes. You should always remember that. So how is the condition over there? So which are the dushas? Means which are the dhatu, mala, upadhatu, khamala, which are the dushya behind that? Then which are the srotas? Then pranadi srotas are the most important srotas in the examination point of view. So how is the condition of the Agni? How is the Jataragni? How it is a Dhatu Agni? How is the Ama condition? Whether is a Sam or Niram. Yog Ratnakar has mentioned the Sam and Nirama dosh, Sam and Nirama lakshanas of the Netra Vedis. So here is some hint I have learned from the I have experienced from my few years of practice, that can we correlate the Sarvadaik Vyadhi, means this can we correlate the systemic disease with the Netra Vyadhis with reference to Nidan Panchak? Can we correlate like that? If yes, then it will be very easy to understand and establish the treatment protocol of the Netra Vyadhi. As we know that the our Acharya have told that the only Samprapti, Samanya Samprapti of the Netra Vyadhi. And they have mentioned only the very few chikitsa, means the very that the Hetu par Nidan Parivarjan, Vatadinam Pratighataha, and Kriyakalpa. These are the only 3 points they have given. If we want to elaborate these all the chikitsa, and we have to understand the chikitsa in each state of the disease, we should able to correlate these Netravyadi Samprapti or Netravyadi Nidan Panchak with the with the systemic Nidan Panchak, means if, with the help of Udara Chikitsa, with the help of Shota Chikitsa, with the help of Rakta Pitta Chikitsa. Can we correlate like that? If yes, then few are the here are the examples. So why to correlate before studying to correlation? Why to correlate this thing? Because they had netra, means systemic disease, and netra vadis are produced from the same entities like dosha and pancha mahabhuta. So if we want to correlate, then the Shatkriya Kal, which is applicable for the Deha, means systemic disease, which can be applicable to the eyes also, for the Netra Vedis also. Some Panchamahabhutas applicable for the Deha, which they are similar to the Netra. So like Dosha also, Tridosh are samely applicable to the Netra. Condition of the Agni in the body is equally important in the netra. Condition of the armor, condition of the srotas are as similar as the structure in the netra. So netrok samanya hetu we can tabulate like this according to Sushrut Samhita, and according to the our day-to-day practice we can conclude like that aharajanya, viharajanya. If we have the case paper of our own, we can write like the hetu like that for the easy understanding of the disease. Is the Vyadhi is because of the amla pitta? If we examine the patient with the redness of the eyes, is there a history of amla pitta? We should able to select the hetu from the ahar. If we the hetu is from the vihar, or there is any manas hetu, or if there is any abhigat, then if there is any vega udirana or vega dharan, or panchakarma vyapad. So after studying the whole shlok of this Samanya Hetu, you must have by hearted this whole shlok. But if we tabulate like this, like the Aharajanya, Viharajanya, Manas Hetu, so it will be easy for the understanding of the disease. Afterwards, you can try like this. You can tabulate the hetus of the patient like Aharajanya, Viharajanya, and Manas Hetu. So after putting the Hetu, if we can we understand the samprapti of the netrog on the basis of Shatkriya Kal? Yes, if we understand the samprapti, samanya samprapti of the netra rog, we are able to make a flow chart like that. The sanchaya, prakop, prasara, sthana samshraya, and vyakti and bhed. So netrog samanya samprapti, the vitiated dosha goes in the upward direction and stays in the eyes and produce the disease. Same the Shatkriya Kal, we can correlate with the samprapti of the eye disease, and it will be easy for the treatment perspective. So we can tabulate the Purva Rupa and Rupa Lakshanas like on the basis of Vatach, Pittach, Kapach and Raktach. Everyone is knowing this thing. I will not go detail in this. So just now I told that the only these three things are there in the Sushrut Samhita. If we want to elaborate all these things, we should able to correlate something with the eye disease. So we are correlating with the systemic disease. So after treating the patient, I have come to know uh, that the Chikitsa Sutra of the systemic disease is directly can be applied to the eye disease. So I am going to show you the few examples of that systemic disease and the eye disease condition. So in the uveitis, anterior uveitis, if we follow the treatment of Amvat or Vatarakta, then it is easy to treat the disease. We can use the अमृतोत्तर कषाय अमृतोत्तर कषाय संशमनी वटी कैशोर गुग्गुल then any lepers as a bidalak, then it is, and any virachan churna according to the condition of the patient, it will be easy to treat the anterior uveitis. Same condition like the chalazion, we can correlate with the Medosh Granthi. Glaucoma, can we consider with the treatment aspects of the Udar or Mutra Kruchra or Shirshambu Rog? Yes, the Shirshambu Rog mentioned in the Vaishyaja Ratnavali. So there is a line of treatment given for the Shirshambu Rog. Can we applied this aspect to the treatment of glaucoma? So I'm using this principle in the treatment of glaucoma and I'm getting results. So I'm not claiming a big results, but the results are there in the maintaining the health of the retina and to decrease the intraocular pressure. So another example is easy to treat that CSR and systemic macular edema with the treatment of Udar and Shodh. That the Mutral Chikitsa, Udar Chikitsa, Mutra Virechan Chikitsa is easily applicable for that. Means the Shwadamshradi Gugulu, Patya Punarnavadi Kashai, Punarnavadi Kashai are the easily applicable in the treatment of this disease. So the most easy to treat part is the vascular disease, means the diabetic retinopathy, vascular occlusive disorder, CRVO, BRVO. Then we can correlate with the Urdhva Raktapitta Chikitsa. So if we give the line of treatment like the Urdhva Raktapitta Chikitsa, means the Virechan Chikitsa. The best line of treatment is for the Urdhva Raktapitta is Virechan, of course. For the Virechan Chikitsa, we can use the appropriate Virechan Churna. We can use the Vasa as a selective drug for the treatment of diabetic retinopathy. Means the Vasa Ghanavati or Vasa Guduchadi Kashai can we easily use. So here we observe the patient with the modern equipments. We are able to see the blood accumulation, proliferation of the blood vessels, mild edema in the macular edema in the retina. So after observing this thing, we are able to give the treatment. We come to the point that we should able to give the Sandhaniya Kalpa. Means I am using the Sandhaniya Mahakashaya in the vascular disease. Means in the Shadvirachan Shatashridiya, there is a Sandhaniya Mahakashaya. I have prepared the tablets of the that kashai, and I am prescribing this to the patient with the diabetic retinopathy. So there are the miraculous result of these tablets. So along with the Vasakuduchadi kashai, Nisha Katakadi kashai, I am using this treatment. So Sama Netrog can be treated with the line of treatment of Jora. most important part is a degenerative diseases. Means the degenerative disease uh, are the most important part in the treatment of the treating of the ophthalmic diseases. So here are the modern medicine will not able to improve the vision of the patient. So they tell that we can't help you. The patient the vision will deteriorate day by day. So if that disease we can, like the ARMD condition, we can use the Vatavyadhi Chikitsa, Dhatukshayjanya Vatavyadhi Chikitsa, we can directly apply for this disease. So in the occlusive disorder, we can use the Margavrojanya Vatavyadhi Chikitsa. In dystrophy patient, we can use the Rasayana Chikitsa. After correlating this, you can also able to correlate other ophthalmic entities. So right now I have told some. I'm giving example of the glaucoma, like the udar. Udar, the samprapti is Rudhva Svedambu Vahin. Yes, there is a angle closure, primary open angle glaucoma. There is a obstruction in the trabecular meshwork. So can we apply this same principle with the glaucoma or udar vyadhi? So nityam average. This is a line of treatment. We can elaborate day by day after getting the experience in the practice. So Jala Shirshak, I have told in the Bhaishya Ratnavali that they have mentioned the medicine should be Mutrala and Mutra Pravartak and Rakta Dosha Shamak. This medicine can be directly applied to the glaucoma. So they have mentioned the Salila Shoshachurna. It can be directly used in the patient of the glaucoma. So this is the basic protocol for the treatment of the ophthalmic disease for the research purpose also and also day-to-day practice. So first stage, we can give the Dipan, Ampachan medicine for the patient. In the second stage, after assessment of the doshas, we can give the Snehan Svedan to the patient. In the third stage, we give the Abhyantar Aushadis and Kriyakalpa along with that. And in the fourth stage, we can give the Apunarbhav and Rasayan Chikitsa. If we follow these four stages, then it will be easy to treat the disease in any stage of the in the any stage of the disease. So there is another clue. After seeing this correlation, we will see the another method of the examination or the treatment of the eye disease with the Ayurvedic treatment, for which we will go with the modern science. On which platform do you think the ophthalmic diseases are grouped? Do you know? Yes, these are the modern medicines have made the classification of the ophthalmic disease. If the patient come to you with the same presentation, patient came with the diabetic retinopathy, we can name as a vascular systemic disorder, then infective disorder, then inflammatory disorder, then the refractive disorder. Some patients come with the IOP related problem. Some patient come with the malnutritional diseases. Some patient will come with the congenital diseases. Some patient will come with the degenerative ARMD diseases. Some patient will come with presentation of the contagious diseases. Some patient will come with the traumatic diseases. Some patient will CNS, some systemic disease means the thyroid eye disease, hypertension, diabetic retinopathy. Some patient will present with the complaints of autoimmune disorders, systemic lupus erythematosus. All these classification is a very important for our understanding. If we consider single group, that we consider first vascular group. So which disease from the modern perspectives are come under the vascular entities, we should able to examine that. Then which line of treatment, which pathophysiology is behind that, we should able to understand that. So these are the steps to get the understanding about that disease. So first stage is understanding the pathophysiology of that disease in the detail. So how is the disease diabetic retinopathy caused? Which are the physiologies behind that? So we should able to understand. Note down the all subtypes and stages of the disease. That is background diabetic retinopathy, NPDR, PDR, diabetic eye disease. We should able to tabulate all these things. Then compile all the possible treatment modalities applicable for the disease according to the Ayurveda. This is the most important part. Now onwards, you should compile all the treatment modalities. I will discuss later on. You should compile all the treatment modalities on the paper for the each subgroup, each group of the disease. Means vascular disease. For the vascular disease, these are the treatment modalities which we can use. What other use, it is not important, which I can use easily. You should able to write down. Then draw the flow chart of that samprapti, pathophysiology, and the stages of the disease. Prepare the treatment protocol. Then according to the stages, after getting the experience day by day, you will able to prepare the protocol of that disease. Means if the patient come with the background diabetic retinopathy, I will give this treatment. I will think like that. If the patient come with the NPDR, I will think like that. I will give the patient treatment. I will give a treatment like this. If the patient come with the PDR, I will think like that, and I will give the treatment like this. So you should able to prepare the treatment protocol. The most important and most obstacle in the treatment of the Ayurvedic disease is the lacking of the treatment protocol. Hence, today onwards, you should prepare the treatment protocol. It will be easy to you day by day and rectify yourself day by day. Then another point I have told earlier that rectify this protocol as per day by day and your uh, experience also. So after treating the patient, yes, I have not getting result with this tablet in this stage, so I can use this tablet in other stage. Means if we use the chandrakala ras in background retinopathy, no, this is not very useful in the background diabetic retinopathy. It can be very useful in the PDR, or it can be applicable in the PDR along with the Vasaguduchadi Kashai. Yes, we can able to postulate like this. So if we follow these steps, you will able to know the each disease stage and the treatment in a single moment, in the single click. So follow this step and we will get lot of confidence from this stage. So earlier I have discussed that the Ayurveda have n number of the medication. So the treatment medication, treatment modalities which we should use as a single kashtaushadhi, combination of the kashtaushadhi, churna in the churna form, like the another is a rasakalpa. We should able to use all the rasakalpa from the kharaliya rasayan, kupi pakwa rasayan, bhasmas in all stages. Then the kashayas, all the kashayas explained in the Ashtangrudaya Sastra Yog Sangra, we should able to use. So today onwards, you should write the each kashaya on the separate paper and understand the which on which stage of the disease I will prescribe it. If the vasa kuduchadi, which are the ingredients of that, and on which stages we can give the vasa kuduchadi kashaya and sandaniya kashaya, chandrakala ras. I'm talking about in context with the vascular disorder for the treatment of the vascular disease. Then which are the tablets I can use? Which medicine can be prepared easily by myself and I can use. You should think over it. Which type of gugulu I can use? Which type of ghruta and taila I can use for the treatment of the ophthalmic diseases? Which are the kriya kalpa I can use easily, and which kriya kalpa will be cost effective? We should able to postulate, or you should able to tabulate all these things. So Bidalak is a very non-expensive Kriya Kalpa and can be easily performed in our OPD, and also we can advise the patient to do at the by himself at the home. So Ashotana, Bidalak, sometime anjan also we can give to the patient to medicate by himself. We can prepare anjanas by ourselves. We can convert the anjanas into eye drop as prepared by the Sridriyam pharmacy. So we can think over that the treatment modalities. So different treatment modalities is our best and unique weapon. So you should master in this selection of the medicine. So as on second slide, I have told we'll look into the goals and plannings. This is the most important part we neglect in our day-to-day curriculum. So have you thought about that? That the um, knowledge source like book, internet, visiting other institute, I have as I have earlier told, then you should get the knowledge from the other sources also, like internet also, visiting other institute, other modern modern hospitals also, modern labs also you can visit. Then have you thought after completing my post graduation or in the during the post graduation studies or curriculum, which books I will read, which institute I will visit, make a plan of that. Which how will I join the further fellowship? Are there any fellowship courses in the our field, or as we join the other institute for the experience? Then have you thought about the proper place for the clinic? Have you purchased the place for your clinic? This is the right time, or this is the appropriate time to think over this. You should able to make a plan right now. Take a paper and write down the all these things step by step. Then have you thought about that our required OPD setup? Yes, this is the very expensive part of our practice. So now the chair unit, slit lamp, auto refractometer, then the basic tonometer. Most important is a slit lamp camera. These are the basic fundamentals which are required for our clinic. Have you thought about this? Yes, you should now, today onwards, you should think about this right now. This is the right time to think over this. So write down your goals and plannings on the paper and try to pursue it. If you make the of your plan on the paper, it will be easier to remember and easier to pursue it. So here are the some tips to improve yourself. So improve yourself day by day. Be patient. So there is a no any rush to get the knowledge. So improve yourself day by day. Yes, I have made the mistake. Yes, I will improve myself. I will rectify myself. This should be a motive. So keep yourself up to date. Yes, I have learned 10 years back. No, I am not knowing this technique now. Not right now. No, this should not be a condition about you. So you should able to keep up to date yourself, make up to date knowledge, make up to date equipments, uh, make up to date your treatment modalities. So nowadays patient requires ashotana in the form of eye drop. Have you thought have you thought about this, that this ashotana formulation I will convert into eye drop? You should think over this. Then be active on the social media. This is the important, most important part, that the people are not knowing about the Ayurveda ophthalmology. So you should make aware the people about the Ayurveda ophthalmology by social media like the Facebook, Twitter, Instagram, for the awareness of the people about the Ayurveda ophthalmology. Most of the people don't know about the Ayurveda ophthalmology. You should able to convince them about, yes, we have this treatment modalities, we have the miraculous results about these diseases. You should able to aware the people. So you should keep ready printed material. This is the most neglected part, I think, that you should. If the frequently asked question means, I have made the frequently asked question on the paper, means 15 points are there. Means if a layman is having diabetic retinopathy, if he wants to get the Ayurvedic treatment from you, if he is having any doubts in a mind, so you should have the ready frequently asked question format. So it will be easy to convince the patient in very few times. If your institute is having the such a format, it is very good. If you don't have the frequently asked question format, it should be there in for easy convincing the patient. So you can make a dinacharya chart also. You can keep ready eye care tips for the computer works, for the computer workers, and other things with the vihar charts, ahara charts, pathya charts ready for the patient, for the treatment of the eye diseases. Give enough time to the patient. This is the most important part. You should listen to the patient very patiently. Yes, you should give enough time to the patient, listen to his complaint, and give give your thinking behind that. That yes, this is these things have happened to you. I am going to treat like this with this medication. You will get relief by these days, in these months. You should convince the patient like that. So the take home message from the today's lecture is, most important is believe in yourself. That the most important part. That yes, I will do the Ayurvedic ophthalmology practice in the society very well, and with the lots of confidence. Then believe in Ayurveda. Yes, all these things are mentioned in the Ayurvedic texts. So you must have learned the or read the Netra Prakashika Grantha. So you should able to believe in the Ayurveda, and then success will run behind you. This is the golden rule behind that. That believe in yourself, believe in Ayurveda, and follow the Ayurveda, and success will run behind you. Yes, don't claim about the unrealistic results. Yes, patient with the came with the diabetic eye disease, and you should not tell. Yes, within 7 days you will get proper 6 by 6 vision. No, don't do like that. Convince the patient. Yes, this is the condition. Your vision is 6 by 24 right now. Yes, we will able to settle the vision at 624 by the month of by the 1 month. You will not deteriorate further. Will not give chance to further deterioration of the vision. Tell patient proper prognosis of the disease. Don't claim about the unrealistic result. This is the most important part. Then explain exact condition. Yes, you are having the proliferative diabetic retinopathy. You are in now in a serious condition. You should not neglect the condition. So in this condition, yes, I am giving these treatment modalities for the 15 days. These kriya kalpas are the 15 days, and after 15 days I will assess your vision. I will assess your fundus, and afterwards I will start the further treatment. And on what which area we will work, you should able to perform. Are you going to improve his vision, or are you going to stable his vision, or or are you making the further, are you stopping the further deterioration of the disease? You should able to explain the patient very well. So you should always remember that the patient are judging you. Yes, patients are judging you. Be confident in front of the patient. So and then add a value to the patient. If patient come to you with for the treatment only, so you should give him a pathya chart, or the eye precaution chart, or frequently asked question chart. So patient will get the value addition. Means the patient be far means with the treatment also. Along with the treatment, you should able to give the extra things to the patient. Means you can explain eye exercise to the patient, and other tips to the patient. Hence be remember that you should give the extra to the patient. So don't copy the others treatment. This is the most important. Yes, is that fellow has given the same treatment, I will give the same treatment. Then don't do like that. Prepare your own treatment protocol. After listening to this lecture, you are able to understand how the treatment protocols are prepared. So you should able to the treatment protocols according to the disease entities. That in the vascular disease, I will make this protocol. In degenerative disease, I will make this protocol. In inflammatory disease, I will make this protocol. You should make the protocol by yourself. Be patient and go step by step. So I conclude this lecture. Thank you. Thank you very much, sir. Thank you, SS Ayurved College, for giving me such a great opportunity to communicate with the PG student and the faculty members of your college. Thank you, Dr. Naveen sir, HOD, Shalakya Tantra, and a special thank to Dr. Vivek Solapurkar sir, who introduced myself to Dr. Naveen sir, and thanks to my beloved students. Thank you very much. So if you contact me personally, this is my contact number. You can note down, and if you have any doubts, you can ask me right now. Yes. Hello, sir. Yes. Hello, sir. Hello.
Sir, you are audible, sir.
Ah, yes, yes, yes. Tell me. Yeah.
We have a little network hassle
Yeah.
at times.
Okay. 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 Yes.
So that was indeed a very elaborative and motivational session for all of our students.
Yes.
It trouble you again if you could share a few cases and their details as to how the approach can be made literally with a few examples of clinical cases. That would be even more to a next level.
Ye-
So when you are free for another session, might be we can take that also as
Yes.
a one session.
Yes. Definitely, sir. Definitely. I will explain on the diabetic retinopathy. Yes. Vascular disease, I think. Yes.
Graduates, scholars, you have some queries for sir?
Sir, with
Yes.
what?
Yes. Yes. Tell me.
Namaste, sir. Wanted to know how about if patient is taking continual steroids or any other form of chronic medicines for managing their condition from the allopathic side. During our
Yes.
treatment, it will be advised for them to continue, right, sir? Or how is it?
Y- Yes. If a patient is taking the allopathy medicine, we should not discontinue it abruptly. Give the treatment for the 7 days, then make a follow up after 7 days, then another 7 days, another 7 days. Examine the patient. If he really requires the steroids, then you can continue with that. If you are confident with your treatment, your results, then you can stop this medicine. There is no problem in case of the steroids. If
Okay.
the patient is undergoing the anti-hypertensive medicine, you should continue it.
Okay.
Yes. Yeah.
Yes, sir.
Yes.
Any other scholar who would want to speak? How is the practice going on, sir? OPDs have started there.
Yes, I have conducting the OPDs. The patients are very few, but I am communicating with the patient with the only telecommunication. Uh,
Oh, okay,
yes,
okay.
yes, yes. But the very few patient comes with the serious traumatic injury, foreign body. They have to visit the clinic only.
Scholars. Sir, we have an expert in Pune
Yes,
who does Agnikarma and glaucoma, if I'm right.
yes,
By
yes.
chance, you know him, sir?
Yeah, but I'm not getting right now his name. Um,
Huh.
but I will text you his name. I'm not getting exactly right now. I'm not remembering right
Yes,
now.
yes, yes.
Yes,
No,
yes.
no. Have you met
Uh,
him, sir?
no, sir, no.
Okay.
Um,
So I have been trying a lot. I could not meet him this time when we had been to Pune. There was a
yes,
conference in
yes,
Pune.
yes,
All of us, we with the PG scholars, we could not meet
yes,
him.
yes. Okay.
We'll see, sir.
Yes, sir. Yeah.
So that was indeed a very nice session, sir, and nice having you. So we
Yes,
would be
thank you very much.
disturbing you again, maybe when you are free. So
Yes, sir.
that we
No problem.
can dive into the subject also a little in regards
Yes,
to a single particular entities where we can have a few discussions going on. So
definitely,
nice
sir.
having you,
Definitely.
sir.
Yes, thank you very much,
Thank
sir.
you very
Thank you.
much, sir.
Yes,
Thank
yes.
you. Thank
Thank
you,
you.
one and all.